For those of us that are already our customers that are joining, thank you so much. Our clients, our partners, thank you. For those that are new, we are in for some good time. We have some very skilled speakers talking to us today, supply chain experts talking to us, telling us how we have been using tech to supercharge supply chain for the past 10 years in Nigeria, in Kenya, and very soon in Rwanda. So these are all information that we'll be sharing with you. And permit me to jump the gun and say this is the part one of the four-part series. And it's going to keep getting better. It's going to keep getting better as the series go on. So you get that information. So I think we can start now. Yes, we are at 9:08. We can definitely start now. And while my colleague starts to share his screen, I'll start by introducing myself. My name is Yewande. My name is Yewande Maburu-Koje. I work with Shelf Life. I'm the country marketing manager for Shelf Life. And it's a pleasure to have you here. It's a pleasure to have you all here. Thank you for joining. What are we doing here? Our objective here is to share with you. Our objective here is to share with you what we have been doing with supply chain for the past 10 years, as I mentioned, with the Nigerian Ministry of Health, with Kenya, and now as well with Rwanda. We have been supercharging supply chain for a while on the public side, and we have decided that let's take it out to the private. In addition to that, we are working with donor foundations who have empowered us to be able to distribute maternal health innovative tools to every single place in the whole of every single city, every single state in the whole of Nigeria. We will be doing this. We have started doing this in the last quarter of December, and we'll continue to do this. So what is the objective? What is the current objective of this series? Let me see, is someone presenting? Jay, are you presenting the slide? Hello? Jay, are you seeing the slide? Are you presenting the slide?
Yes, I am. Just a moment, it's coming up.
Okay. All right, that's fine. Because I would like to show what is our objective and what exactly are we hoping to achieve at the end of the four series. We are open to share with everybody here that innovation to maternal health is not a one-time thing. Innovation to maternal health is not a one-time thing. It's everybody. You can go to the next slide. Thank you. It's a comprehensive approach. We want to share that beyond. We want to be able to show. Please go to the slide before this one, Jay. All right, thank you. So we want to be able to show to everyone that there are several innovations that are coming in place now, and we want to make it available. We have been empowered to make it. We have been empowered to do this, and we are ready to ensure that any innovation that comes in terms of maternal health, we make it available to you through tech in the most seamless way possible, right? We also want to show you at the end of the series that it's a comprehensive approach. It's not going to be one thing meets all. There's going to be some system level change. Meaning some of the processes that are happening in hospitals, they need to be upgraded. Not that anything that we are doing is bad. It's just that maybe some things that we are doing it because we don't have some things available. For instance, cold chain is not available. What is the alternative? Or how can we help in terms of financing? How can we help with that? We have all that available as well through this series. We believe that when there is knowledge, anything can happen. You just like we were at a program yesterday with SFH when they were talking about empowering mothers. Empowering with knowledge can make anything happen. Evidence-based solutions will be sharing with you the solutions that we are bringing. Why are those solutions? What is backing it? Is it just from us, or does it have some other science attached to it? And then finally, accessibility. There is nothing as important as learning about new things and then not being able to get it. You will be able to get everything that we are sharing here. Next slide, please, Jade. So the series, as I mentioned, it's a series. We have 4 series already, and we'll be issuing a certificate of completion for everybody that joins. And as I said, it will be getting better. For instance, the one on the 30th of May, for all of us that are joining here, you will get, you'll be the first to get access to that, the information about that. And we are working to partner with SOGON, that's the Society for Gynecologists in Nigeria. We're working to partner with them. And as it moves on, each series, each episode will keep getting better than the next. The next slide, please. So please mark the dates and we'll share this with you. Some of the basics, some of the data that I just want to share with you, my colleagues will be sharing more. As I told you, we have experts here, supply chain experts, procurement experts, pharmacists, and all other professionals that will be sharing with us in this short period that we have here. Not just information for Nigeria, Kenya, and other parts of West Africa that we have been empowered to distribute last mile delivery for free. So we know with data has shown us that instead of the staff to be doing exactly what they should be doing in the hospital, they're looking for supplies. I'm a pharmacist. I've worked at UCH before, and I think I was telling this at the last ANPMP conference, where I was talking about a colleague of mine that was slapped by a patient just because she had waited so long to get it, or is it a pharmacy that you have your pharmacy shop, you have bought supplies, but because somebody has not arranged the supplies well, people are coming in and saying, I want to buy, but then your staff is telling them it's not available, but it's actually available. They just didn't store it well. That is part of supply chain. Inefficient storage mechanism or storage strategy is part of supply chain. Procuring when items are in season, like post season, procuring when they're in season or out of season is part of supply chain. How are we using tech to help you? How are we using tech to help in terms of maternal health? We'll tell you. Another data showed that 3.8 billion is lost, and this is just Nigeria. You can imagine what is being lost in other places just because there's inefficient supply chain in the health sector. At least I'm aware that for now, a huge part of West Africa is still paying out of pocket for healthcare. So that means the health sector is still more expensive to the government and even to us than it should be. So supply chain should not be a problem. And every shortage can lead to a loss of life or compromised care. So that's why we now looked at, okay, at Shelf Life, we're already doing this. How do we laser focus what we are doing with respect to maternal health? So that's why we now introduced what we called Safe Motherhood Powered by Field. So Safe Motherhood Powered by Field is a program where we have a vision, and our vision is that healthy mothers deliver healthy babies. At the program, I think it was yesterday or day before yesterday, the special advisor to Lagos State Ministry of Health, she mentioned that, she said, no child is left behind. We are appreciative of our fathers, but we know that they need to be out there to be working. We know that they need to be working. The mothers too need to be working, but who is carrying the baby full time? Who is bringing out the baby in? They say, I can't watch my infant head when sleeping on my cradle bed. It's the mother, right? While the father is braving the elements of the world to bring money in. So no babies left behind. No mother should die on the bed. So what we are doing with our program, Safe Motherhood Powered by Field, is that we are accelerating new and old therapies into practice. We are financing your ability to get this and also providing cold chain access. And then we are providing comprehensive and supply chain solution at scale. I know I mentioned to you that there are different aspects of supply chain. It's not just There are different aspects of supply chain. It's not just somebody supplying to you. Somebody's supplying to you. It's it's all about it. Even the money, even being able to get it to you wherever you are. It's all encompassing. So the way we'll be doing when it comes to the question in here, what we'll be doing is that when it comes to questions, right? What we'll be doing is that you'll be dropping your question in the chat box, and then we'll be getting it. Or at the end, we're going to have a question and answer session. You can raise up your hand and talk freely. Talk freely there. Paul Sanks, Marilo Hospital, you are very welcome. Thank you for joining. You can keep introducing yourself in the chat box. So at this point, I'll hand over to Sharon. Okay, yes, I've done my own 10 minutes. I'll hand over to Sharon. Sharon is our supply chain expert and has been working with tech to she has been working with tech to ensure that supply chain is seamless across Nigeria for quite a while with Field. She'll tell you how she has been doing this, and she'll also tell you how she has now started doing this with respect to safe motherhood. Sharon, are you there?
Yes, I am. Good morning, everyone. How are you, Andy? Good morning.
Good morning, Sharon. Thank you so much for joining us today. So I'll hand over to you, and Jay, please help Sharon project our slide. So while the slide is coming up, Sharon, you can warm us up by telling us what you'll be talking about. Thank you.
Okay, so if I would be able to present from my end, because I made some last minute changes to my slide, I would appreciate that.
Yes, go ahead. You can.
All right, thank you. All right, please let me know if you can see my screen.
Yes, I can see your screen.
All right. Good morning again, everyone. It's great to be here. I am excited to be taking us through how field and how shelf life is supercharging the maternal health supply chain in Africa, specifically in Nigeria. Just to give a background, every minute a woman dies from complications in childbirth, and this is as a result of very preventable causes such as postpartum hemorrhage. And the truth is that most of these deaths are not due to the fact that the doctors or the midwives don't know what they are doing. They're not due to the fact that the drugs are, not available. They're just due to the fact that the medication is not available at the right place at the right time. So, that's the problem. And in Nigeria, we've been able to do our own research. We've done our homework, and we've seen that, over 45% of health facilities in country report stockouts of life-saving uterotonics like oxytocin because of, as a result of broken supply chains. And I'll be unpacking how shelf life is turning the tide and ensuring that no mother, is dying, or no mother dies while waiting for, these essential products that are already available, already existing. I'll be taking us through some common supply chain challenges in maternal health. I'll be taking us through the impact of some of these challenges, impact of stockouts, impacts of quality issues on maternal outcomes. And I'll also be taking us through how through shelf life's approach to building a reliable supply chain system in Nigeria. Okay, so I'll briefly talk about field, because I know from the first slide we saw a field logo, and then we also saw shelf life, just to give a background in case there are people here that don't know who field is or what shelf life does. So field is the organization that empowers African healthcare providers in every setting, governments, that's public and private healthcare providers. So we empower these providers with technology, we empower them with fulfillment, that's physical, supply chain logistics, and we also empower them with financing to expand the access to care. So first, Field Supply is a software as a service, is a tool, is a tech tool that's helps with health supply chain management. We like to describe it as a control tower that connects different actors in the supply chain ecosystem, from governments to private institutions, healthcare providers, pharmacies, patent medicine stores, hospitals, drug revolving funds. So we support these providers through this tool that's specifically designed for the health supply chain. And this tool is used for reporting, it's used for planning, it's used for fulfillment, it's used for analytics as well, to examine, all the data that comes in, and is used by all these healthcare providers, both in the public and the private healthcare space. Then Shelf Life is the distribution and financing arm that provides the same providers with high quality pharmaceutical products through the Field Supply platform. So Shelf Life uses pooled procurements, we plan, we fulfill. That's long haul, last mile deliveries to healthcare providers. And we offer different services. We offer vendor managed inventory, we offer financing, that's a revolving line of credit for inventory purchases. We also offer basic or instant deliveries. And then finally, we have like a market access program, which involves, building and introducing new routes to patients for manufacturers and donors. So this is essentially bringing in, there are gaps in some essential medication that are still not available in country. So we leverage our digital and our distribution capabilities to just accelerate the introduction of new products, in Nigeria as well. So this slide is about the problem. What's the problem? In Nigeria or in Africa, women are 45 times more likely to die in childbirth than any other continent. And, the leading cause is postpartum hemorrhage. From the charts, the pie chart, you can see that postpartum hemorrhage is a huge chunk of the pie itself. 27% of it makes up to 27% of the cause of death in women that give birth, women that are in the process of giving birth. So we know that, there are some underlying factors, such as, many of these women have sometimes have like unknown, high or poorly managed risk factors. And in a lot of facilities, there's a lack of diagnostic tools to, adequately diagnose and even know, if they have any underlying or risk factors. And we also have an inadequate supply of quality heterotonic drugs in these facilities. These are even for the women that, give birth in facilities. We also have a lot of women that give birth at home as well. And we would like to say it's a supply chain problem, and it's also a market problem. It's a market problem because, if you look at the challenges that is faced in the Nigeria, both public and private healthcare space, we have weak information systems. A lot of information consumption happens, at the last mile, at the facilities, hospitals, primary healthcare facilities, and this information is not being tracked. So there are no records keeping systems available to track. The supply chain is fragmented, it's broken. There are a lot of actors doing different things. They are, all over the place. It's not streamlined. We have infrastructure problems. We don't have, for example, cold chain equipment in these facilities to store cold chain products. The infrastructure itself in Nigeria, for example, the roads are not good, for distribution of drugs, And then we also have resource constraints from that, the lack of resources to, finance to get this life-saving medication. A lot of providers would have to ration, what is available to them. And all this presents as a supply chain problem. We also have lack of trained, workers. We have, so we would say that it's a supply chain problem. There's poor data management, financing, there's no capital. And there's also a market problem because of the fragmentation, and, the limited investment in supply chain. A lot of new therapies that would come in, they're only maybe interested in making a profit, introducing high markups, but they are not really interested in, contributing or even improving the system, the supply chain system in country. So that's what we call rent-seeking therapies. So also a bit more about the problems. So what leads to a weak supply chain? We have market fragmentation, we have weak data management, and we have inaccessible finance. So, for example, if a provider is struggling to even understand what their consumption is because they're not keeping records, they would struggle to stock the right quantities. So they're either understocking or overstocking. So overstocking will lead to expiries. It will lead to them tying down their cash. Then understocking will lead to stockouts and, missed sales, and, they would not be able to administer these treatments. And then this is just like a ripple effect. So this would lead to like poor health outcomes. There's no growth in the supply chain market, the health supply chain market. Quality of care is reduced, and the providers will struggle to even continue with their business and struggle to grow and even sustain their business. In Nigeria, we have a lot of macroeconomic challenges. We have inflation, we have high cost of medication, we have currency devaluation. All this leads to, a very, difficult market to operate in. And if, if demand is not adequately, is not monitored, you'll not be able to forecast. Forecasting will not be able to happen, and it will lead to all these outcomes. And then there'll be supply chain gaps because obviously there are no adequate, storage, infrastructure, transportation, and this will just lead to high cost, high prices of commodities, and the providers not even being able to stock them. So narrowing it down to postpartum hemorrhage, these are some of the data that we were able to pull because from the Nigeria's National Health Logistics Management Information System, that the public health facilities use to report their consumption. So 75% of facilities report oxytocin concerns due to cold chain failures. And we have substandard, that's the quality now, substandard oxytocin, leading to either double dosing or wastage and treatment failure. So when there's the fear that this oxytocin was not stored properly, I'm not sure how potent it is. A lot of these providers, these midwives would either double dose, so administer double doses, which would lead to obviously higher cost of treatment to the patients, and it will lead to wastage as well. And then also misoprostol is also very relied on. So you would hear like a midwife say they use misoprostol, not because it's the best option, but because, that's what they can afford, that's what they can have access to. And cost to serve the postpartum product has increased by over 25% just in the last few years. And the availability is not there. 25% stock out rate of oxytocin in public health facilities, and then rationing as well of oxytocin. And so, MNCNH, the products are not, they're not getting to the right people. The cold chain capacity, cold chain infrastructure is, non-existent, and there is no existing route to patients system for even new product introductions, and the MNC supply chain is very, I would say, weak, and it also leads to a lot of gamble happening at this point of care. So what's field or what's shelf life doing about this? We've been able to find a way to build ourselves into the value chain to improve outcomes through, like I mentioned at the beginning of the presentation, tech solution, digital solution, which is field supply, that helps with tracking of inventory, helps providers to make data-driven decisions, data-driven operations, and on the financing side of things, we extend credit to both private and public agencies through revolving credit revolver. Then for coaching as well, this is one area that we've been able to build our competence in the last 1 year. We've been able to, supply, oxytocin to, over 200 facilities. And this has, strengthened the oxytocin coaching supply chain in country. It's led to, improved health outcomes in these facilities we supply to. And for supply, we've been able to, introduce the PPH bundle, which my colleague will be throwing more light to the products that make up that bundle and what they do. We've been able to introduce into markets. We've been able to introduce even, new products that were not even in country before. That's like the drips and the heat stable capitocin. Been able to introduce that and, supply it to facilities, and the feedback has been very great. This has helped. That's gone a long way at these facilities that they've been introduced to. We've been able to use pool procurement, aggregate our demand and pool procurement to get better pricing for these products. And these products are quality products approved by WHO, approved by SRA, and the likes. So this is what field and shelf life is doing for the MNCNH supply chain in Nigeria at the moment. And these are some of the capabilities, both software, that's digital, and distribution capabilities that shelf life provides. We provide ordering. Providers can place orders at any time. We have, aside the PPH bundle, we have a standard MNCNH bundle that covers a lot of products as well. We have a total of over 3,000 products we offer at the moment across over 50 treatment areas. We also offer rewards, we offer cashbacks, we offer free deliveries, at no cost to the provider. We offer financing solutions, either the vendor managed inventory service where providers can only pay for what they sell, or financing, that's the credit revolver. And there's also the record management side of things where providers can, view the history of what they've ordered to reorder. We also have inventory management capabilities. Clients can, see transaction history on their wallet and also monitor their inventory as well. We provide operational support through recommendations, through planning, and our strong suits, which is delivery. We provide, fast delivery nationwide, tracking of shipments, and also an electronic proof of delivery. So these are some of the things, and our networks with retail pharmacies, hospitals, clinics, public facilities, donor programs, drug revolving funds, NGOs, and the like. So these are all the providers we can support. So I'll just conclude by saying that, yes, there's a problem in the health, in the maternal health supply chain in Nigeria particularly, but field is doing something about it. And it would be a very great idea to have, as many people on board on, this great initiative that field is, bringing out there to improve the health supply chain in Nigeria. So that would be my bit. Thank you.
Thank you so much, Sean. Do we have any questions for Sean, or should we move to the next presentation? Or we take the questions in the chat box. Okay, Sean, let's see whether questions will come up in the chat box, and then we can move from there.
Okay.
Hi, Henry. Are you ready for us?
Good afternoon, everyone. Is anyone sharing the screen, or do I go ahead and do that?
You can go ahead and do that.
Okay, just give me a second.
Or Jay, if you have the... Jay, you can project Henry's slides if you have it.
I'm doing that right away.
All right, Henry, we have your slide.
Yeah, can you guys see my screen?
Yes.
Yes. All right. Good afternoon, everyone. Once again, apologies for dropping in late. I'm sure we've talked about the postpartum hemorrhage bit of things, and here I'll be sharing what the bundle entails, and then I would talk about the relevance of each product in the bundle, and then I would also discuss about the availability and what we intend to offer. It's a really short slide. I doubt we would spend more than 5 minutes on it, but I'm sure it would really pass a message across the team and everyone joining this meeting to see what we are trying to do and what we're trying to prevent. And I think the goal here is for safe motherhood. And I'm sure by the time we're done with this, we would, join hands to ensure that we improved, the outlook when it comes to, pregnant women have giving birth and, having a successful delivery at it. Yeah, so the components of our comprehensive PPH bundle entails oxytocin, tranexamic acid, calibrated drips, misoprostol, and heat-stable carbetocin. One of the things that drives this bundle being created has been a lot from the trials being done to show that early detection goes a long way in preventing, women from losing their lives after childbirth. And just to ensure that that persists, it's it's necessary that every outlet that gets involved with safe delivery needs to have this bundle included, as it's been very, very effective. I don't know if anyone has gone through the emotive trial, but that really shows a lot, gives a lot of insight as to what this has done in improving, mortality rates in pregnant women. So these are the 5 products that we bundled up to make them a bundle, to ensure that they are available, to ensure that the prices are great, and to ensure that there are, several payment plans that could enable these products remain in stock rather than get stocked out due to poor planning or maybe a bit of finance constraint. So these products are actually offered on, if possible, based on credit checks will confirm if it's going to be on consignment, where the products are stocked on your shelf, and periodically we'll do some counts and then you pay for what you sell. For some cases, we would have to run payment plans where you'd have to pay on a weekly or monthly basis. So it all depends on what the outfit is ready for. So in summary, it's a bespoke model, but what's constant here is that these products all come as a bundle, and we've ensured that they come at great prices. We've ensured that the availability is enough, and we're trying to use our planning algorithm and matrices to ensure that these products are always available at any given time. So I pulled this up from the World Health Organization because it's a worldwide strategy that is being put in place to ensure that this reduces. And of course, we all know the impact Nigeria and some parts of Africa play in this, because Nigeria has a lot of deaths due to postpartum hemorrhage. So this slide actually shows that detecting postpartum hemorrhage early goes a long way in, preventing death. And one of the products in that bundle that helps in detection is the calibrated drips. The calibrated drips is a very fantastic invention in our healthcare practice. Very simple, very easy to use, but very effective. It has really helped practitioners detect postpartum hemorrhage and initiate treatment immediately. So that's where the E comes from, which is the early detection. And what triggers that early detection is the calibrated drips. It's calibrated in 300 and 500 mils. So it's calibrated. So basically, when that blood is being collected, there's a map that shows where the blood needs to get to for you to initiate treatment. So the 300 mil mark is in yellow, the 500 mil mark is in red. So when it flows to that range, then you might need to initiate treatment, right? And that's where oxytocin comes in, right? That's another drug in our bundle. Oxytocin kicks in, and what oxytocin does here is it helps after the uterus is being massaged, and it has been your uterus is being massaged for about a minute, and then oxytocin is given, and then periodically it's given over time to resuscitate, and then after that, tranexamic acid plays a role here. Okay, and then of course IV fluids are given, then examination is done, and if there's still further need to intervene, it's escalated, right? So if you look at this slide now, we've been able to touch points on each of the products to see why we made them a bundle, because you can see the role they all play when postpartum hemorrhage is detected. So the calibrated drips for early detection, of course the oxytocin also plays a role, and the tranexamic acid also plays a role here. I think one product that is not on this slide is the heat stable carbetocin. That's the one here, the one at the end of this slide. And just like the name implies, it's a very wonderful formulation in the sense that it doesn't have to be stored in a cold chain condition, just like oxytocin. So what this does is that in areas where there's a suspicion that the integrity of oxytocin
Yes, Henry.
Hello, can anyone hear me?
Yes.
Okay. Yeah. So in the area where there's you feel that the integrity of oxytocin has been compromised, that's where heat stable carbetocin takes its place. It replaces that fact and gives the practitioners confidence that the right medication is being used. For us here in field, we have a cold chain process. We ensure that these products are being tracked and monitored. The temperatures are also being checked on an hourly basis, just to ensure that we maintain the ample temperature for oxytocin between 2 to 8. But as this webinar we are having currently, it would be nice for us to just explain where heat stable carbetocin kicks in, and it just simply helps in regions where you're not sure of the integrity of oxytocin. It's a very heat climate regions. That's where heat stable carbetocin kicks in. Yeah, so I think that's a summary of what we have in our bundle. Like I mentioned earlier, it's widely available everywhere. We have a distribution center, and currently we're covering over 30 states and more. So we are ready to work with anyone, any registered practitioner that wants to, help in driving down this huge problem that we face here in Nigeria. So I think that will be all from my end. Thank you very much, and thanks for your patience. It took me quite some time to join the meeting. Thank you very much. Over to you, Yewande.
Thank you so much, Henry, for that. As you know, as Henry mentioned, we have the slide. I said we have the slide. We have the product. We have the capability to distribute it anywhere in Nigeria. And we are willing to make this happen. All you have to do is share your information with us. You can share it right during this webinar, and then you can make it available to you. Yeah, some people are already doing that now, and rest assured that we are working on that. So, in order to optimize time, we're going directly into the product demo. We're going directly. I made a mistake. I muted myself. You can drop all your questions in the chat box while that is going on. The product demo will be the product demo is the last thing that we'll be doing. Then we'll go into question and answer. The reason why we are doing the product demo is because we know that we have some people here that have not come on board the Shelf Life platform. Remember, we said in the beginning, we are making sure there's accessibility, regardless of whatever it is that we might be talking about. No matter the webinar, no matter the education, we need access to what we are talking about. You can imagine going for a training about something fantastic, but you can't find it. It's not logical. So what we are doing here is that we are providing the education in this 4-part series, and we are also making available every single thing we are talking about. In fact, if you want the slides that we used to present, we can give you access to the slides. We can do that. Just all you need to do is ask. And for all the products, we'll be sharing the prices here. And you can, now we want to show you how to place your order. We want to show you how to ask for credit if you don't have credit, if you don't have the revenue available for it. And how you can do all this from your phone or your device. So Folashade will be doing that for us today. Folashade, are you there?
Yeah, good morning, everybody.
Hi, Folashade. Thank you so much for joining us. So I'll hand
Good
over.
morning, everybody.
Yeah.
Okay, no problem. So I'll be sharing my screen. So for this part of the demo, I'll be demoing creating signing up for the first time, or ordering, and also applying for credit, and also paying for your orders in app as well, since we have that feature as well. We can pay seamlessly. So for the first demo, I'll be demoing a managed credit user. This user already has a credit, and I'm just going to go through the ordering workflow. So first of all, this is like a user that has a lot of invoices unpaid and whatnot, but the urgent workflow is where I'm going to begin with at the moment. So let me try to log out and show you the login page. So, like I said earlier, you can apply for credit. So we have the module here where you just at the click of a button, you apply for your credit. You give us like basic information of your business, when you started your business. You can give us your housing number, then give us the sales of pharmaceutical and other else commodities the last 12 months. So you can just do this. Then just basic information and your BVN number, which is also hidden and safe and not exposed to any other users. Then you can upload your identity. These are just the process to apply for credit. You can give your bank statement. Most of all of these are not compulsory, but it's nice to have while applying for credit, so you can be well informed and give you your appropriate credit limit. So this will better inform us on how you could deal with your credit and how much credit we can give you eventually. So now we see that you've applied for credit. You can see the status of your credit application. From this point on, Shelf Life will access all your documents and give you credit and give you credit, and you can start purchasing. Now I'm going to log in as a user that has credits. That has credits. So let me just get the user. Okay, while we wait for this to load now, this is a customer that has credit. So this is how it appears on your wallet. We show you the amount of credit that you have and the amount that was used and your limit. So for this client, it had 300,000 Kenya shillings. We're using Kenya as a shillings currency here because I'm logged in as a Kenyan user. Then for that's to show that our application is multi-tenant. We work in different countries and with different currencies, so it's not only restricted to Nigeria. So for this, we now going through the urgent workflow. We go to product, just as similar as other products. Just search for the product that you want. Search for the product that you want. Let's do oxytocin. Okay, let's do zinc. You add it to cart. You can see the amount that we have in stock. So you can order for all of it or less than it. So where we do 100. So we could do anosol. Let's do anosol, same as well. This 160. You can search for more products. Let's do paracetamol. Let's do paracetamol. There's no paracetamol in the system, but we have other painkillers that are close to it, so we can pick that as well. So you can pick as many as possible to add to your cart. So we have this your cart here where you can also review what you've picked. We try to suggest other products that are similar to what you've picked, or the ones that are similar to the group that you have picked as well. So here I can also add anyone that comes up as options that are similar in class with what I've picked initially. Then you could you could also increase your product here, and you can also remove as well. You could save in case you still want to add more and you want to get more lists. You could save and continue later. That means we save what you have on your cart. Once you log in again, you can continue from where you stop. So you don't have to start from the beginning. So you can proceed to check out. Here you pick your delivery date, where you the date you want this item delivered to you. And to just to note, all our deliveries are free, no matter the date that is picked. So you can pick any date that we suggested for you, or you can select your own preferred date where you want it to be delivered. So here, let's use a preferred date. Okay, I want it to be delivered to me on this date. Then now this, because this client is a credit client, you have the opportunity to pay as you please, and as pay as you please. So we have different payment plans. We have for 4 weeks, we have for 4 weeks, we have for 6 weeks, we have for 8 weeks, we have for 12 weeks, and for more others greater than a million, greater than 2 million, we have 24 weeks. We have you can even pay as you like, depending on the value of your card. But for this value of this card, we can pick 4 weeks. For 4 weeks, we don't have any fee added to it. 6 weeks, no fees are added to it. But from 8 weeks and above, a little fee is being added to to your order, and we can continue with the 6 weeks. Here we complete our order, and you get a confirmation card where you can also track your payment. So once you can also track your order. So when you come here, you can track your order. You can see the status of your order. So once your order is getting close to you or getting packed for you, you get the status here that, oh, your order is being packed, your order is arriving. You know the arrival date. Once this order has been created by Shelf Life itself, we give you a shipment ID that you are going to use to track it. You're also even going to know the fulfillment partner's name that is coming to deliver these goods to you as well. You also have the order ID that you can copy and even send to any of our CX member, just to get more information on your order as well. And if all of this information is not also sufficient, you can also contact our customer service support, and we respond in 15 minutes max. So that is the ordering workflow for an MC client. So like I said, you can come to your service tab and track your order. Now this is the order we just placed, and we saw that it's coming in 21st of May. You can still view your receipt, you can still view your order and get the order status as well. And another beautiful thing we have in our product is we want to make your ordering workflow really simple for you. If you have an order you've placed previously and you want to repeat it, you can see your previous order here. It takes you here, and you can pick any of the orders that you have done before, instead of going back to cart, clicking all of them and changing the quantity. So you can just your order here repeat your order here, and we give you exactly what you ordered before. You can as well change your quantities here as well. You could add more products as you wish, and you can also proceed to cart. Same process. You can pick any payment plan you want and how you want to make payments, and that's the beautiful thing about the application. We want your ordering workflow to be really seamless, and so you don't. And we have a very intuitive um, search search bar that you can use for your search. And we also try to put all top. We try to do like an analysis on products that are top performing across your geographical area. So you have top performing products here. You know that, oh, good, these products are really performing well. I can add this to my pharmacy. You have price. We have products that we've highlighted as the great prices, and we've checked all market value, and we know that our own has the perfect price, and you can also pick that as well. Now I'm going to demo how to make payments. So now we go to your wallet. So you go to your wallet. Okay, sorry, we need to complete the delivery first before we make payments. So I'll just try to demo a user so we can make payments. So for the payment options, we are integrated with Paystack. You can pay with Paystack. You can do a direct transfer. So here it pops on your own page. You see your wallet. So you can also use this sidebar to get to your wallet. You can use the home page to get to your wallet. Now you can see all of the invoices or installments. So for this customer has done a delivery that is worth 837,000 plus, and has divided its payment plan for 8 weeks. So you can see that the person has paid the first week, has paid the second week. So you could pay for the third week. So we have the options, the payment model will come up, and you can see all of the Okay, yes, you can see all of the options that we have. You can pay with your card, you can transfer, you can also use USSD as well. So for the purpose of this demo, I'm going to be using a card transfer, and this is just mimicking how it looks like on a live environment. This is our test environment. So I'm just going to assume that I'm paying with my card, it's successful, and I made payment for this payment plan. See, our payment process is very seamless, and it doesn't take up to like 10 minutes to make your payment in app. As you can see, this has been paid as well. And you can be feeling a little bit generous. I'm like, oh, I have a lot to pay. I want to pay it at once. You don't even have to wait for all of your payment plans to be due, like this customer. And you don't even have to wait for the due date of these payment plans as well to also make payments. You could also liquidate your payment plan. This will attract less fee. And for this demo, I'm going to be using another payment method called bank authentication. So now let's make payments. I've authenticated with my bank. Authenticated with my bank. Sorry. So this is a third-party application. Yes. Yeah, now our payment was successful, but this customer still has other payment plans to make. So we have demoed the process of this call. We've demoed how to apply for credit. We've done how to order. We've done how to make payments. So I just demoed how to make payment for installments. This is another type of like an invoice that was not converted to a payment plan, so you can just make payment just at the click of a button. You can make your payment, and confirmation is done, and you know that your invoice has been paid automatically. Now has been paid automatically. Yes, you can see successfully paid. So that's a very seamless payment option that you have as well. And to demo the to demo
And for that, Shade, you have 5 more minutes.
sorry, come again.
You have 5 more minutes.
Okay, no problem. So I'm just quickly going to demo how to sign up. That's the most important part of the
You shared on how they
application.
can repeat their last order.
Yes, I did that.
Mm.
Sorry, trying to get the sign up page up. Okay, so yeah, so you have, when you come to the shelf life application, you click on sign up. Then we just ask for basic information, the name of your pharmacy, the name of the pharmacy owner, your email address, your email address, your email address. You give us your phone number. You identify your pharmacy, your retail type. If you're a pharmacy, you're a PPM, you're an hospital, the country where you are in, and the state where you are. For me, I'm in FCT, big F is FCT, the town you are in, then your address. So if you've been referred by anybody, you could put the person's name here as well. We have like a privacy policy for you to just tick and you can get started. So that's the simple way to sign up on our application. Immediately you do that, you get a password on your email. So let me just try to go to my email. You see that we get an email. So we get an email from Shelf Life for you to activate your account. You can set your password. So from your email, you can set your password and log in and start purchasing or making orders. Thank you, Yawande.
So it's very important for us that as businessmen and businesswomen, we give you the access to be able to order for supplies right from the comfort of your office or from your home. We are here talking about strengthening maternal health supply chain. We are saying that we want um, we want maternal health to be better. We want mothers to be healthy. We want babies to be happy to see their mothers. We don't want any baby left behind. But at the same time, we are saying that as businessmen and businesswomen, that we know that you are in your hospital, in your pharmacy, or anywhere it is that you are, you should be able to access products without entering the sun, without entering the rain. You should be able to access products. You should be able to get what you want at the best price, regardless of the state that you are in. First of all, you don't need to enter the sun or the rain to go and look for products in one market where you are not sure how they are keeping the products. Number two, you don't need to be staying in a state where there's a big drug market before you can say you're getting the best prices. With Shelf Life, you are getting the same price everywhere. Then number three, you want to have oxytocin, you want to have the best one. You want to be sure that this is the one that the cold chain has not been tampered with. You want to have misoprostol, you want to have the original one. You want to have tranexamic acid, you want to have the most cost-effective one, and then the one at the best price. You want to have the blood calibrated drips. I mean, Henry showed us how the drips is being used to monitor blood loss after delivery. And you can imagine something that is not up to 2,000 naira. It's not even as expensive as it's not even as expensive as it's not even as expensive as the product, as the data that we use to check our phone and to dance on TikTok. It's not even as expensive as that. And that alone has been said that in the emotive trial resulted in 60% reduction in maternal mortality that would have been due to postpartum hemorrhage. So you can imagine something that cheap. It needs to be everywhere. Everybody that is going to give birth should have it everywhere. So now we are going into our question and answer session. I thank you for those of us that have been sending in your question. Sending your question here. We have some questions here, and I will employ Henry to assist me in answering some of the questions when it comes to ops and supply chain for Henry as well. Then we have Mr. Aminu Mohammed. He's in Zaria. He said that almost all to-yield pharmacy products are not available. If Mary Badmos is here, you can help to answer some of the questions. Said that we are still in need to adjust the delivery time, and he really wants to procure all his inventory from shelf life. We run a very robust procurement system. And I'm sure from all I've been saying, you will have realized that we don't procure from the open market. We procure directly from manufacturers or exclusive distributors into Nigeria. So if there's a particular product that we don't have now, it's possibly that particular company either does not have their products as at that time, or we are restocking. Remember, we are stocking for the whole of Nigeria. So it's best that you check your app. Most of the time, we send notifications that a particular product is available. We even do bundle products sometimes. For instance, we did Emzor bundles recently, where all products in the Emzor portfolio was given at a discounted price. And a lot of people have benefited from it. Even our tranexamic acid today is the least expensive price today in Nigeria for tranexamic acid. For those of us that are not in Lagos, that are not in Abuja, I think it takes within 24 to 48 hours to deliver to you, because we do use air, we use the air, we use the road to deliver to you. What I would say is that if you want faster delivery, if you want to maximize your logistics, your inventory management, which is another webinar that we have done before, we are willing to do it again if people signify the interest, is that order for what you believe you will use in a month. Let's send it to you. Let's help you. We can work with you. We can work with the sales associate associated with you in your state to ensure that you can place your order twice a month. Everything that you've accumulated together, you send. We even have a way to help you to use AI, to use formula, even if you don't want something that is so tech, something very simple, to use this formula to anticipate your need. So it doesn't even need to finish. There's minimum stock value, there's minimum reorder value. You can use it to anticipate your need, to place your order in a way that you don't need to place order for much, but just exactly what you need to have, so that you are not having stock out. You don't have a situation of, oh, I don't have, let me quickly place order for shelf life. Then you're under pressure before you come. I've worked in community pharmacy before. I've seen the situation where you always have. I've seen the situation where you don't have. Where you don't have, you are losing money. So I understand that, and we are working very well to ensure that our delivery timelines are continually optimized. So please continue to reach out to us. We have noticed that we need to work on our timelines, and we are doing that. We continue to do that. And if anybody has any feedback of good experience or bad experience, please drop it here. So I want to summarize what we've talked about here today. We've talked about supply chain, what we are doing with supply chain. I told you we got a grant of $11 million. We are still spending it. And that's what we are using to ensure that these products are getting to you at the best prices, real time, and at free in terms of delivery charge. Oxytocin is the Rotex brand. Misoprostol, we have the by 10 and by 4, very good prices. We have E-stable capitocin, which currently I think is around 16,000 for a pack of 10, bringing one vial to less than 2,000 naira. But this is currently available only in the public space. We have tranexamic acid, which is around 2,009 for pack of 5. We have the drapes. The drapes is 1,600 and something naira, and it's used per mother. It's not reusable. So we are inviting you to join us in eliminating mortality due to PPH, due to postpartum hemorrhage in Nigeria, in your community, because it starts from you. It starts from you. And you've seen how to get access to it through our tech. If you need any other support, please reply to our emails that we've sent to you, or reach out to us on shelflife.co. Reach out to us there, and we'll get in touch with you. Does anybody want to ask a question before we sign out? We come to the end of the webinar. Are there any questions? Okay, there's a question. I was using credits platform. All right, so this is Miss from Owutake Feelings. All right, thank you. So what you are describing is an issue with credit. Yes, an issue with credit. So we can do, there's a lot that can be done with respect to, okay, maybe delayed payment and all of that. All you need to do is have a discussion with us, just like I mentioned. I'm going to drop the phone number of our CX now on the of our CX now. So a lot of people that have had this information, when it comes to maybe your details are blocked, that is just AI, artificial intelligence doing its job. Oh, so and so and so as a block has not paid. I want to drop the phone number here on the platform here. Has not paid. The login details are blocked. That's just AI doing its work. 091 935 0324. Yes. So that's just AI doing its job. That doesn't mean that you are blocked to everything that we can do. All you need to um, all you need to do right now, send to meeting group chat. Yes. All you need to do right now is call us and we can discuss with you on how you want to arrange your payments. So that way, everything you need, you can still access shelf life. You can still make your payments and you can still purchase until we figured out how to arrange the payment. There are a lot of people that maybe due to forgetfulness, due to change of staff, maybe the staff that was in charge of their finances, like the accountant or something, left the job, left the company, and did not follow up with the payment as at when due. Because you know the money we make available to you is in terms of stock, is free of interest. If before you default on payment, it's free on interest. There's nothing, we are not holding any collateral. So all we ask is that you pay as at when due. So if that person is not there to prompt the owner of the company or the finances to make the payment, there can be an issue. So we are ready to talk around it. We have a credit team that is ready to talk around this and make necessary adjustments that should be made so that it's a win-win for all of us. So please call that number or send them a message and then we can put that process, start that process for you from Owutake. So we can do that for you, please. Or you can, share your number with me privately as well, and I'll ensure somebody reaches out to you. Any other questions? You can unmute yourself and ask any question you'd like to ask. Do you have any other questions? Okay, I think we don't have anything. So again, thank you so much, everyone, for joining. We look forward to seeing you on the 30th. On the 30th, it will be more gynae focused because we are going to have okay, my question is on non-availability of some antibiotics. All right. I think I know this name. She's a fantastic client of ours. I think you're a patent medicine. I think you're a patent medicine vendor, Miss Rukayat Adeoti. I think you are. So as I mentioned earlier, there are some products that might not be available right now. Maybe because we just finished supplying somebody, or we have wholesalers that come and buy in bulk because we have wholesaler pricing. It might be because of that. However, if you are registered with us as a PMS, any medication that requires a prescription might not be completely available to you. And that's because we are working with ACPN guidelines to ensure that we are working with the guidelines and we are working with the law, actually. We are working with the law of Nigeria when it comes to supply of medications. Every medication that can be available over the counter is available to every single person. However, you need a particular license to get access to prescription-only medications. Now, I am aware that there's an accreditation that's going on for patent medicine vendors, an accreditation that involves the PCN Council. We were made aware of this information through CEDA, that's the PACS program. We're made aware of this information through them. So when that certification comes in from the Pharmacist Council of Nigeria, and we are told that we can now make available antibiotics or prescription-only medication to patent medicine vendors, we are ready to do that. We are ready. We are only erring on the side of caution and being, how will I say it now, being following the code of ethics that we should follow in terms of supply chain of healthcare medication. But that does not stop us from sharing the education like we have done here, right? And the one of the next webinar, there will even be so much more education that will be available when it comes to gynae cases, that by the time you are sharing this with your customers, they're like, doctor, you know. But at the end of the day, you will still be able to know that, okay, at this point, I know when to refer to the doctor. I know when to refer to the hospital. But you'll be of more value to your community. So that will be coming on the 30th of May. And we look forward to seeing everyone there. And Ms. Rukayat, we can talk privately. I'm on the WhatsApp. We can talk privately as well for any other questions you might have. Do we have any other questions? Questions or feedback? Okay. All right. Going. All right. Thank you so much, everyone. Have a great rest of your day. And thank you so much for joining the call.